This movement gently takes your ankle through multiple directions, helping maintain flexibility while encouraging movement throughout the lower leg. Better ankle mobility can contribute to improved balance and smoother walking, both of which become increasingly valuable with age. Now let's move to one of my favorite exercises, the seated heel raise. Sit tall with your feet flat on the floor and your knees bent comfortably. Slowly lift both heels while keeping your toes touching the floor. Pause for 2 seconds at the top, then lower your heels back down in a slow, controlled motion. Repeat this movement 20 times while breathing steadily. As your calf muscles contract, they help move blood back toward your heart. That's one reason these muscles are often referred to as the body's second pump. Staying active throughout the day and performing gentle movements like these may help reduce stiffness from prolonged sitting while supporting healthy circulation. Our fourth exercise is the gentle nerve mobility movement. Sit upright and slowly straighten one leg while gently pulling your toes toward you. Hold for only 1 or 2 seconds before lowering your foot back to the floor. Repeat this movement slowly 10 times before switching to the other leg. The goal is gentle motion, not stretching into pain. If you experience sharp or severe discomfort, stop the exercise and seek medical advice before continuing. Finally, we come to today's most important exercise, the alternating heel and toe tap. Sit comfortably with both feet on the floor. Raise your toes while your heels remain on the ground. Then reverse the movement by lowering your toes and gently lifting your heels. Continue alternating in a slow, steady rhythm for 1 to 2 minutes. While performing this exercise, close your eyes for a moment if you feel comfortable and focus on the movement of your feet. Pay attention to how they feel as they touch the floor. This mindful awareness helps you stay connected with your body's movements and encourages better control and coordination. As you practice these exercises, remember that improvement usually doesn't happen overnight. Nerves heal slowly, and progress often comes through regular daily practice, healthy nutrition, staying physically active, managing underlying medical conditions, and following your healthcare provider's recommendations. Celebrate small improvements because they often lead to bigger changes over time. A few important safety reminders before you begin this routine. Always use a stable chair that won't slide. Wear supportive footwear if needed. Move slowly and never force a painful movement. If you have severe numbness, open sores, significant swelling, sudden weakness, or you've recently had surgery, consult your healthcare professional before starting a new exercise routine. If any movement causes severe pain, dizziness, or worsening symptoms, stop immediately and seek medical advice. If you found today's video helpful, please support the channel by giving this video a like and subscribing. Your support allows us to continue creating simple, practical health videos designed especially for older adults. Don't forget to leave a comment telling me your age, your symptoms, and which country you're watching from. I truly enjoy reading your stories, and your experience may encourage someone else who is going through the same journey. Thank you so much for watching. Take care of yourself, stay active, stay hopeful, and I'll see you in the next video. If you have been feeling burning in your feet, tingling in your toes, numbness that seems to get worse every week, or a sensation that you're walking on cotton, sand, or tiny pebbles, please don't ignore it. These symptoms may be your body's way of telling you that your nerves need attention. Many people believe these changes are simply a normal part of getting older, but that isn't always the case. The good news is that there are gentle movements and healthy daily habits that may help improve comfort, mobility, and confidence. Stay with me until the very end of this video because every exercise builds on the one before it. Skipping ahead could mean missing important steps that make the routine more effective and safer to perform. By the end, you'll have a complete routine that you can begin practicing at home. Hello everyone, I'm Dr. Peter, and welcome to the channel. Over the years, I've met many older adults who felt frustrated because they were living with constant tingling, burning, numbness, or weakness in their feet and legs. Some worried about losing their balance. Others were afraid to walk outside because they feared falling. Many believed there was nothing they could do except live with these symptoms. While neuropathy can have many different causes and treatment depends on the underlying condition, gentle movement, improving circulation, and staying physically active can play an important role in supporting nerve health for many people. Before we begin, I'd love to hear from you. Please leave a comment below and tell me 3 things. First, How old are you? Second, what symptoms are you experiencing? Is it burning, tingling, numbness, sharp pain, or balance problems? Third, which country are you watching from today? I read your comments because they help me understand what topics would be most helpful for future videos, and they also allow viewers from around the world to encourage one another. Now, let's take a moment to understand what neuropathy really is. Your nerves are like electrical cables that carry messages between your brain and the rest of your body. They tell your muscles when to move, help you feel temperature and touch, and allow you to keep your balance while walking. When these nerves become damaged or irritated, those messages may not travel properly. That's why some people experience numbness, burning sensations, tingling, weakness, or pain, especially in the feet and legs. Neuropathy can develop for many reasons, including diabetes, vitamin deficiencies, certain medications, injuries, poor circulation, or other medical conditions. Because there are different causes, it's important not to ignore persistent symptoms. If your numbness is getting worse, if you're losing strength, or if you suddenly have difficulty walking, you should speak with your healthcare professional as soon as possible. Getting the correct diagnosis is the first step toward choosing the right treatment. Today's routine focuses on simple chair-based exercises that many older adults can perform comfortably at home. These exercises are designed to encourage gentle movement, improve flexibility, promote healthy circulation, and help maintain mobility. Remember, consistency is far more important than intensity. Small improvements repeated every day often lead to better long-term results than doing too much all at once. Let's begin with our first exercise, the toe spread and curl. Sit comfortably in a sturdy chair with both feet resting flat on the floor. Slowly spread your toes apart as much as you comfortably can. Hold that position for 5 seconds while breathing normally. Then gently curl your toes downward as though you're trying to grip the floor. Hold for another 5 seconds before relaxing. Repeat this movement 10 times. Although this exercise appears simple, it encourages movement in the small muscles and joints of your feet. Keeping these muscles active may help maintain flexibility and improve awareness of foot position, which becomes increasingly important as we age. If moving your toes feels difficult, don't become discouraged. Simply attempt the movement as best you can. Even small efforts matter when performed consistently. Our second exercise is the seated ankle alphabet. Lean back comfortably in your chair and slowly lift one foot a few inches from the floor. Imagine your big toe is the tip of a pencil. Now slowly draw each letter of the alphabet in the air using only your ankle. Move carefully without rushing. After completing the alphabet with one foot, repeat the exercise with the other.